Dear listeners, welcome to Faces of Digital Health, a podcast about digital health and how healthcare systems adopt technologies. I am your host, Tjasa Zajc, and today we will talk about cybersecurity in healthcare. According to Clearwater Cyber Intelligence Institute, one of the key issues in data breaches are user authentication deficiencies. These include password strength requirements, single sign-on controls, and locking accounts after too many failed login attempts. Additionally, people use generic passwords, they physically post passwords on a workspace, or do not encrypt credentials in emails over external networks. If the key issue of data security and privacy protection in the past was how to archive data and prevent unauthorized physical access to these archives, the cloud brought a whole new set of challenges. For one thing, security measures required from the personnel are getting increasingly complex. Additionally, while several advances have been made on the technological level of data protection, from different methods of encryption to high hopes stemming from AI development and quantum computing, the bad guys are also using these technologies, says Chris Bowen, the founder and Chief Privacy and Security Officer of ClearData. ClearData is a US-based company offering technology and services to assist organizations with their healthcare cloud security needs. Chris and I discussed the trends in cybersecurity in healthcare, the future, and what organizations should be mindful of when it comes to healthcare data protection. Enjoy the show, find the transcript on our website www.facesofdigitalhealth.com, and do subscribe to the show if data privacy, security, and protection are among your interests. In the next episode, you will hear about GDPR and the upcoming medical device regulation from Jovan Stevovic, co-founder of Chino.io. Now to cybersecurity with Chris Bowen. This discussion was recorded in late December 2019. Chris, have you ever been told that cybersecurity is boring? IT people are a special kind, especially when you pair them with doctors and medical staff. They speak two very different languages.
To be honest with you, I have been told that cybersecurity is boring, not by any of those folks, but by my teenage daughter as I drive her to school on conference calls talking about the importance of cybersecurity. Beyond that, no, I've actually never been told by anyone in the health industry that it's boring. It's one that is top of mind as the healthcare industry continues to struggle with staying ahead of the threats, protecting the patient data, both here and internationally, and making sure that privacy standards are upheld, and more importantly than ever, having the information necessary to provide the proper treatment to patients as they're in one of their most vulnerable states as they go through the healthcare system.
My impression is that efforts to create data privacy, to enable patients to have their data safely stored, are increasing, which we will come to later. But at the same time, it seems that cybersecurity is increasingly problematic in the sense that the number of cybersecurity attacks are increasing. Can you, for starters, share a little bit of your insight in the basic trends around cybersecurity in healthcare?
Yeah, absolutely. I analyze these kinds of data points every quarter as we report to our board and to our customers some of the trends that we see. We analysis this quarter up to between now and the beginning of the quarter. There have been 90 healthcare breaches exposing 1.4 million records just this quarter alone. Now, if you think about the trends that go back between now and last year, the number of breach victims this year totaled 563% more this time than last year in the U.S. And this is according to the Department of Health and Human Services Wall of Shame, where breaches are reported. To put that into numbers, 2018, there were about 7.2 million patients with their data compromised. This year we have about 40.5 million patients with their data compromised. It's interesting to note that one of the most basic ways that this data is compromised is through email. And in fact, just this quarter alone, there were 2.9 million records exposed because of disclosures in email. And that can relate to either sharing patient records by using email, or the vast majority of that, of course, is phishing attacks where people are tricked into providing access to information within a system because they think they're sharing with someone that they know, or they have a trusting relationship with who they think is a legitimate person but may not be. And so that's a very disturbing trend that we've seen continue to happen this year. And I've written on this several times. In fact, one of my, ardent articles about this was simply titled "Stop Emailing PHI." It's a easy thing to prevent, and I think there's a lot of ways we can combat that.
Before we continue, just a brief question again for you. Because passwords are a big issue, tell me, how many different login passwords do you have? I personally have, I think, 67 different passwords in my password manager for different websites that require a login.
I'm looking that up right now. I also use, by the way, kudos to you for having so many. It's a nice thing to hear that one password isn't used for everything. I have 668 passwords that I have to use, and I have this great tool that allows me to audit which ones are potentially compromised, which ones are used in multiple places. But you're right. I mean, your point is right. If you can't manage your passwords effectively, they become less useful. They become another way to be attacked.
One of the things that sometimes when it comes to security, people think is either I have nothing to hide or I have nothing to worry about. When it comes to these kind of breaches, are usually specific people targeted?
My response to that is similar to one that has been talked about on TED Talks. If you don't care about your privacy, go ahead and give me your email, username, password, and I'm just going to go ahead and watch what comes into your inbox here and there, and you shouldn't really mind, should you? Nothing is more important to me than making sure that the privacy of our patient records are upheld, and that people understand the need to have privacy. And so it's a topic that I find that those who say that don't really understand what privacy is in the first place.
Maybe to illustrate a little bit the problem here, can you name a few examples of the consequences, like real people's consequences of data breaches?
I won't use names. Obviously, I'm a HIPAA and a privacy guy, but I do know of documented reports of a woman who had lost her insurance card at the gas station. She went to fill up her car. She lost her wallet, and in that wallet was her insurance membership card. She didn't think much more of it. She got her credit cards replaced, but didn't really think too much about her insurance card until it was a few months later she was arrested for trafficking in opioids. And of course, she had never done that. She'd never done any of that. But her identity was used to go acquire a massive amount of opioid drugs from various providers throughout different states. And so she had to go through and experience the unpleasantness of trying to clean her record from her medical identity that had been completely compromised by someone who was doing illegal things with it. If you think about the medical record, just for one more moment, if you have a challenge with your record, who do you call to correct that? One transaction, by the way, will go to over 100 different places in the healthcare ecosystem. If you go look at the datamap.org, it'll illustrate it beautifully how many places your data goes after just one simple transaction. So that's one of the greatest challenges with the medical record compromise, is that the shelf life of that record is on average around 10 years. The shelf life of a credit card can as little as half an hour, because the credit card company can simply just go turn it off. You cannot do that with your health record.
Another thing that makes me think in the story that you mentioned is that all those transactions that happened around opioids, as a patient, you don't have no clue, no audit log about the transactions while they were happening.
Exactly. And if you think about the worst case scenario, maybe I've stolen a medical identity to get treatment that I couldn't otherwise pay for myself. And so when I go through that treatment, maybe my medical record is changed to say, hey, maybe I'm not allergic anymore to this specific drug. But yet I am when I go to get real treatment. It could actually kill me because my medical record may reflect an inaccuracy in my allergic reactions, for example.
When we're talking about cybersecurity or cloud computing or digitization of healthcare, arguments from vendors are usually that if you have data on the cloud and proper management of that data is much more secure than physical paper that can get stolen in the healthcare institutions. Yet usually when we hear about data breaches, we hear about these cyber attacks and things that are happening in the digital space.
Well, I would say that it can happen with an on-premises infrastructure, or it can happen with a cloud-based infrastructure. And I've seen healthcare providers try to do both. And what I've seen is that those who try to engage digitally in healthcare using the on-premises solution, especially the providers, they usually are squeezed already from a margin perspective, and what they have to do is buy necessary hardware, the software, the real estate to put the hardware in, the bandwidth. They have to do all of that at the highest capacity that they can forecast, and that literally takes money out of the system that could be used for proper security. It could be used for proper healthcare to patients. And it continues to squeeze their margins to the point that these poor folks within the healthcare IT ecosystem, they're running dangerously low on funds to stay ahead of it. What the difference in the cloud is, you can still engage digitally, but you don't need to scale right out of the gate. You can build to scale as you consume, and that allows you to deploy the resources necessary to better secure your tools, to better employ security measures, to engage partners like a Clear Data, for example, that helps to automate, remediate, demonstrate that compliance and that security, all without squeezing the margins like you would in the on-premises world.
What's your advice to healthcare providers? How can they go beyond just the bare minimum requirements to be compliant when it comes to data security and really provide proper data care with budget constraints and everything? Yeah,
it's a great question. It all comes back to being able to use the cloud to do the job that you need to do. And if you have the ability to employ a partner to help you in that journey, to help you understand how to use the cloud, then you can continue to use your staff, your IT staff, to learn the cloud, to learn how to use it and how to use it effectively, and how to employ the controls that can be leveraged at scale. It's one of the reasons that I started Clear Data was to help those kinds of organizations move into that journey, and as they get better and better, meet the customer, meet the healthcare provider, the life science, the pharmaceutical company, meet them where they're at in the cloud journey to help them understand how to use the new services. I'll give you an example. AWS innovated over 1,900 services and products in the cloud this year alone. And to stay in front of that is a very big, daunting task. If you can leverage people who already know how to do this, do that. If you can find someone who can guide you along that path, by all means, trust them to help you do that. Obviously, do your diligence. But deploy your strategies, create your annual strategy to take advantage of the cloud. And we're starting to see that tipping point where it's not a matter of if we ever go to the cloud, it's how soon can we get there. That's what we're seeing our customers go through at Point.
So what's the general suggestion? How much should be outsourced? How much should be done in-house?
I don't know that it's a question how much. It's what is the use case. You have to really look at what you're trying to do. If you're trying to do a big data type of a workload where you're trying to gain insights from massive amounts of data, you wouldn't want to do that on premises. It's just too expensive to do. If, on the other hand, you're simply trying to do something that doesn't fit the cloud, then I would go through the assessment, the planning process to determine what applications are fit for the cloud, which ones should be rewritten, which strategies you should employ.
If I go back to the problems of authentication deficiencies and passwords, for example, which are probably the most easy thing to understand, according to Clearwater Cyber Intelligence Institute, one of the key issues in data security are user authentication deficiencies, which include problems with password strength requirement, single sign-on controls, people locking themselves out of their accounts after too many failed attempts, and generic password use. Doctors or nurses will tell you that passwords are sometimes written on post-its under keyboards. Based on your expert observation, how much effort do you see organizations putting in educating the workforce about the importance of safety requirements about data?
I chuckle because some of those experiences you just described, the Post-it notes, etc. I think my favorite story when we did a security risk assessment on a hospital in the Midwest, we walked into the radiological exam room, and the doctor was very, very proud that he had written his password on the wall in such a tiny way that you couldn't actually notice it unless you really looked at that spot on the wall. And, so obscurity, security by obscurity doesn't always work. It works better than a Post-it note, but that was a very innovative approach. But coming back to the question, the challenge with passwords are, unless you effectively manage them, like we were talking about earlier, unless you effectively manage them, you'll end up using similar passwords on every single application, and you'll try to take shortcuts. And so what you want to do is you want to design your authentication scenarios, your authentication systems to be user-friendly. Do I need to enter a password every time I come into the room? Does it have to expire every 15 minutes? Well, in some security frameworks, yeah, those are best practices. But if I'm a doctor and I'm going from room to room, maybe I would rather use my fingerprint to unlock something. Maybe I would rather use a token that's attached to my something that I have. If we can get away from having to use simple passwords and just rely on that one way to authenticate, then I think we win. I think if we use multi-factor authentication and really try to make it easier, we increase the security profile and we reduce the frustration.
Can you mention any good use cases in this regard? So healthcare IT companies can sometimes install safeguards to prevent data breaches or just to protect themselves and be able to claim that their system is safe, but it's user unfriendly. If two-factor authentication is great, but it would be a real hassle if the doctor had to, as you mentioned, log into the computer or a tablet every time he went to a different patient. You mentioned fingerprint readers. I see a lot of potential in voice recognition solutions, but I'm wondering how much of that is actually already out there working in the environment.
There are quite a few of our customers that are providers that are doing it very effectively. They range from brain institutes to cancer institutes to life science companies. There's a lot of best practices. And if you think about GDPR for a minute, GDPR defines best practices as state-of-the-art required. And, what does that actually mean? Well, that means figure out your use case in a way that's the most effective way possible to accomplish what you're trying to do.
But what, for example, are the organizations that are taking care of cybersecurity properly and that are taking care of data properly? What are they doing differently compared to other institutions? It was very interesting to me to read one of your articles where you warned that new hires and those that are leaving institutions are a potential organizational threat because those that come in the institutions perhaps are not trained yet regarding the proper measures that need to be taken to ensure security, and those that are leaving, you never know if they're taking any data with them or if they're doing something else that's not a good data practice.
Certainly, if you bring someone on board into your organization and you haven't trained them on how to handle PHI and they're not from the healthcare space, then by all means don't let them touch PHI until they know that they're not supposed to go sleuthing around inside a database looking at it. Let's make sure they understand things like minimum necessary principles and that they are required to adhere to those and not look at things that they shouldn't have a need to look at. But on the control side, you can certainly guard against that by implementing the proper controls. Again, it comes back to role-based access controls. It comes back to system activity reviews. Finding out who's doing what within a system is a very important way to understand that. And there are tools that you can use to enable that. But you actually have to have people looking and reviewing and working on that. The other big challenge that you mentioned is the offboarding and the change of credentials or permissions, rather. And as folks maybe get a different job within the organization or they leave the organization, unless you're tied into some systematic way to centrally manage your authentication, your permissions, using, for example, an Active Directory approach or a single sign-on approach tied to a role-based access controls, you're going to have a very difficult time making sure that John, who left, is actually not in your systems anymore. And that can certainly become a great concern when you're trying to protect data from unauthorized access.
Can you explain a little bit how compliance to regulation is done? So we have laws, we have regulation that are supposed to take care of the requirements that data breaches wouldn't happen, but they do. So what's the cause behind the breaches? How often are audits happening in hospitals?
That is a great question. One of the things that is difficult to do, I mentioned the AWS, number of innovations over this past year. We still have the HIPAA security rule, and that rule has 46 or so different administrative, technical, and physical controls that have to be in place. Some of them are required, some of them are addressable. That hasn't changed significantly over time, but the cloud has, the innovations have. And so one of the things that we do at ClearData is make sure that the regulatory requirements align, or rather the architectural solutions align to the regulatory requirements. So how do you align a basic system within Google Cloud or Azure or AWS that meets the HIPAA requirements? You map the specific requirements from HIPAA to the architectural reference, and that becomes the standard by which you operate with that design. That's not the end of it. Then you actually have to continue to monitor that to make sure that you don't have compliance drift. And I think you read our press release on our platform, release, which is designed to simply prevent that compliance drift by doing auto remediation against those regulations. It's a challenge, and that's one of the reasons that we have been so successful in the industry, is because that's a hard thing to do, and we learned how to do it very well. If you're doing that on your own, it's a big challenge, and I don't know how they would necessarily accomplish that without some kind of automation and a massive investment in that kind of regulatory activity review.
how much do you have to educate the CEOs and the leaders of institutions about cybersecurity? I imagine that, for example, if a doctor becomes a CEO or a leader, he's not an expert in cybersecurity, or perhaps someone with a business background might have the same problem. It's not their expertise, but it's getting increasingly important, especially if you look at all the medical devices and IoT coming into healthcare and an increasing number of devices being connected. And then you can lose track of the third-party providers that can potentially access the data because of the privacy policies that are, intertwined when there's more players coming together.
The CEOs have a daunting challenge in providing healthcare. They've got to, work with squeezed margins. They have to understand how to deliver care without breaking the bank. They've got to secure the data. They've got a thankless job. But if they are starting to take notice. I think the stats that I cited earlier, just this year alone, or last year, 563% greater number of patients have had their data compromised. If I'm a CEO, I'm looking at the cost of delivering care versus cost of pulling money out of the system to remediate a data breach. Well, I think I'm going to take the prevention side a little bit more seriously to try to bolster my systems to prevent that data breach. I'm seeing more and more CEOs in health systems become more aware and more concerned about the cyber and trying to do as much as they can to provide more investment there. You did touch on medical devices, and that's also a great challenge. Just simply understanding where those devices are, how old they are, where they're at in their product life cycle is another daunting challenge within the healthcare delivery system.
I'm sure you heard of a story about the Medtronic insulin pump so it was a big story in July 2019 where two researchers discovered a disturbing vulnerability in the Medtronic's MiniMed, and because the company didn't do anything about that vulnerability, they actually created a hacking app to prove a point that these are serious matter. They created a remote control that could reach many insulin pumps. So, like from a patient perspective, from my perspective, that's kind of concerning because, if nothing else, you as a patient kind of rely on the provider, on the vendor, that they're going to take care of these issues, especially if we're talking about established vendors. But if that trust goes away, I'm getting concerned about, what the future holds regarding the increasing amount of sensors and data that's not being protected properly.
Yeah, I agree with you. We've had meetings with the FDA on this topic and others in the medical device industry, and really the consensus is that in order to combat vulnerabilities in medical devices, it's going to have to be the whole community that takes part. Collaboration really is the key. It's true the connected medical devices are extremely vulnerable. There's patient safety issues at play. There is a shared responsibility, though, and that includes the manufacturers, obviously. It includes the Department of Health and Human Services and the security researchers and the FDA, but also the healthcare providers that are giving these devices to the patient. And so it's a challenge. I think in 2019 there was a little bit of progress made. I think in 2020 you're going to see additional targets for the FDA trying to provide some release guidance. Maybe there's some additional work on what is a threat modeling scenario for some of these devices. There might be proposed legislation, and then another really big effort that's going on right now is how do we secure the legacy systems? It's not just the medical device that's vulnerable. It's back-end systems. It's the back-end operating systems that are now in the end of life, and they can't be supported with patches and security anymore. So, the vision here is that every medical device should actually meet a security baseline. It needs to be updatable, easily updatable, and patients actually need to get some timely updates on whether or not the device they're using is up to date as well to perpetuate that transparency.
It's a crucial thing, especially since the cybersecurity field as such is advancing in amazing ways. So if we were saying before that it's problematic when data breaches cause serious data leaks, there are technologies such as the zero knowledge proofs or homomorphic encryption that in essence enable computations or verifications without revealing the data. So perhaps if we stop here for a while, can you name a few trends in this sense? So how is technology as such improving that it would make data safety as seamless as possible?
It's an interesting discussion around data security, data centricity. On the one hand, you have a need for supplying artificial intelligence systems with enough data so that the AI is not biased in any way. On the other hand, you're trying to secure the privacy of the patients that are part of the ecosystem of healthcare. And so it's a delicate balance. It's a tough one to balance perfectly, and there's great debate on that and as to where the patient can be enabled. We're seeing a lot of great advancements, though, in making the data safer using artificial intelligence as well as machine learning. And those kinds of advancements are going to benefit overall. On the flip side, the bad guys are also using machine learning and artificial intelligence. And now you've seen some announcements from AWS and others around quantum computing, and that's going to turn the whole world of data security on its side in terms of how we approach protecting that data.
Can you elaborate a little bit further? Like, what are the debates around that? Is it going to be even harder to ensure security?
Well, yeah, it's going to be harder. It's going to continue to be more difficult. We're going to have to rethink ways that we are storing data, processing data. I'll give you an example of an approach that's been in place with our company for a little while, and that is microservices use, where you can actually shard data among microservices using containers in a way that if I have access to someone's a credential or a permission, I don't necessarily have more than just a couple of digits in a social security number, for example. I don't have all 80 million records in a database anymore. I have shard of one piece of data for one record. That kind of approach can be done in a way that can vastly improve your security posture and vastly decrease the blast radius, if you will, if something bad were to happen. So when I say things need to be thought of differently going forward, it's easy to say, yeah, I'll just use this database approach. Yeah, I'll just use, I would even go one step further. I would use polymorphic encryption and say, this is great. But if you can think a little bit more outside the box on how to use some of these new services coming from the cloud, then you can better protect your data. This is one of the key areas that I believe the cloud will continue to outpace on-premises feature benefits, throughout the world. There's just no way on-premises architecture and servicing and scale and such can keep up even remotely with those kinds of advancements.
What kind of questions do you get asked most often when it comes to security and privacy?
How does your Patch Tuesday go? A lot of providers are still thinking about the the patching cycles, the vulnerability management. How vulnerable is my system? How do I look from a security perspective overall? And one of the ways that we try to change that up is we think about patching not as an event every week, but a constant. As things are spinning up, spinning down, and sailing, new versions of operating systems should be used that comply with CIS hardening standards that can happen every day potentially. Updates happen every day. And so, I'm asked a lot about, how's the security of my data? Can you fill out this questionnaire so I know that I can trust you? Those are the kinds of questions that we get. And it's different depending upon the provider. If you're getting those questions, if you're talking to a payer or an insurance company, they're asking questions like, can you support a Kubernetes environment where I can trace my PHI through the entire ecosystem? And we can actually say, yes, we have a product called Locate that does that. So the questions differ depending on what part of the healthcare vertical that you're talking to.
I just have one more question for you, and that is, as patient data privacy expert, how did you see the news about the Project Nightingale, which enabled Google to access medical records of over 50 million people in 21 states throughout the largest nonprofit health system in the United States, Ascension? There were mixed reactions to this news. Patients were concerned about being discriminated because this data was suddenly accessible to Google. Of course, the company claimed that data is only going to be used to improve systems, to create new algorithms. What's your opinion?
Well, I have lots of opinions about this one. I think that it's an interesting approach to how this happened. I don't know that it was necessarily carried out the most effective way. I'll be honest. The patients. I've read the notice of patient privacy that the patients signed up for. Every health organization tries to make them as general as possible so they don't have to go back to the patient every time they need to do something. But in this case, it would have been nice for the patients to have some involvement in knowing that their data would be used potentially with Google to help make their healthcare experience better. I do believe that Google has the ability to do some amazing things with that data. My opinion is also that we go back to that minimum necessary principle. Did it really require nearly 200 engineers to have access to individual records within that designated record set? I don't know, but that seems to be a lot. Could they have done anything with masking the data? Could they have done anything differently to protect the identity of the data? I don't know for sure. I don't know that there was anything done that was not appropriate from a legal perspective, but it certainly had a challenge from its implementation and how it was carried out. A good lesson, if you will, on transparency in healthcare, on sharing information with your customers and your patients in an effort to try to save and protect their privacy.
Perhaps just one more question. We didn't talk about blockchain at all. Where do you see the role of it in this story? Yeah,
I think it's got a place. If we think about some of the things I've talked about in the past, it would be nice to be able to leverage some technologies to prevent the breach crisis. And I will say that it is a crisis at this point. If we can leverage auditability and ownership of a record where I now give you the ability to look at a record versus putting it in the hands of someone who may not protect it as well as I do, and blockchain can be part of that scenario, then that's a wonderful thing. I still think there are other methodologies that you can use that can be nearly as effective, but I do believe that blockchain has a place in the ecosystem as we continue to move forward, and that's just one example.
Is there an ideal future that you imagine? How would ideal cybersecurity look like?
I'll give you my vision, but I know the bad guys have their visions too. So it's the dueling pianos, if you will, in the bar. We're each trying to get ahead of the other. The ideal scenario for me would be that we have data locked down and usable where it needs to be usable, that there is instant transparency to those who need that information to know how that data was used, whether it was used for the purpose it was supposed to be used, and obviously whether there's any unauthorized access, etc. If we can prevent data from being accessed and used in a way that it's designed, then that's wonderful. And what that takes is a focus on the basics, a focus on the hygiene that has to be done every single day. That means thinking through new technologies and thinking through new approaches to how we do things. I used the microservices example a few minutes ago. I know that what it takes is limiting human involvement as much as we can and narrowing the blast zone as much as we can using some of those technologies.
You've been listening to Faces of Digital Health. Stay tuned. Visit our website www.facesofdigitalhealth.com to browse through other content as well and leave a rating or a review wherever you get your podcast. Your opinion and support are the fuel for this show. Stay tuned.